Hello friends, hi, this is Dr. Tirth Gill. I want to talk to you today about a condition known as ADHD. This stands for Attention Deficit Hyperactivity Disorder. There's a subsyndrome of this called ADD, which stands for Attention Deficit Disorder. So what is this? This is actually a fairly common condition as these things go. It has a prevalence during childhood of about 5%, and in adults, about half of those children outgrow it by the time they become adults. But in about half of them, or 2.5% of the people, it persists. The ADHD symptoms persist. So, what are these ADHD symptoms? The acronym gives a clue about it. It's a neurodevelopmental syndrome that has genetics in part contributing to it, along with some environmental factors. The syndrome comprises symptoms such as inattention, easy distractibility, fidgetiness, impulsivity in children, an inability to stay on task, being disorganized in their work, difficulty turning in assignments, completing assignments, difficulty following directions. All of these symptoms are part of this syndrome. In addition, impulsivity, hyperactivity, intrusive behaviors in children are also present. In adults, these impulsive and hyperactive behaviors may translate into poor decision-making, impulsive decision-making that gets people into problems with traffic, substance abuse, the wrong kind of relationships sometimes, and financial problems, legal problems, occupational problems. Patients in adulthood with ADHD tend to get fired more often, also tend to have more problems with substance abuse, anxiety, and depression. So it's a significant problem that deserves to be looked at, reviewed. Every doctor should ask about it, be cognizant of it, and when the syndrome is recognized, and they should be competent at recognizing these symptoms, they should be offered treatment. I guess if you want to call it that, the blemish on ADHD as a diagnosis and treatment is that stimulants are some of the best treatments that are available for ADHD symptoms. But stimulants also happen to be abused by a certain segment of the population, so there's a hesitation about giving stimulants to people that could potentially logically abuse stimulants because other people do as well. The surprising fact is that when the ADHD diagnosis is made carefully in adulthood, people do not abuse their medication. They don't give their medication to others because they need it and they find that the medicine is helpful to them. And if someone does have that tendency, that soon is detected, by the lost prescriptions and, it's sort of a drive to keep raising the dose and some unreliability in their overall presentation. So there are ways to, figure out if somebody's abusing the stimulants, but that should not deter people from being offered that treatment when it is indicated for ADHD. The prevalence is about equal. It tends to manifest more commonly in boys because they tend to be a little bit more impulsive and on the hyperactive side, and the girls might have more of the ADD type syndrome. But some girls show significant hyperactive behaviors and impulsive behaviors. So it affects them also. Treatment-wise, there are several different options. You have the non-pharmacological options, which include things such as exercise, meditation. Meditation such as transcendental meditation have been shown by rigorous research to help patients, children and adults with ADHD. Yoga is a very powerful technique, tool that we have also that can decrease anxiety, depression, and improve concentration-related issues. Mindfulness can be helpful. Certain balancing exercises may be helpful. Certain games that you can play on, you can get apps for that. These are concentration games, and I'll put a list of those names, some names for those type of apps in the information box. Those can also help improve concentration. So treatment-wise, the non-stimulant medications are the following: atomoxetine or Strattera, guanfacine or Intinib, clonidine, also has a long-acting form. So clonidine is more sedating. These are blood pressure medications, both clonidine and guanfacine. So they can potentially lower the blood pressure, cause dizziness, have some sedating quality. Clonidine has more of that effect, the sedating effect. So those medications, they are effective. The guanfacine is wonderful in the sense of reducing impulsivity, intrusive and aggressive behaviors in children with ADHD. So sometimes you can combine the stimulants and this non-stimulant with a great benefit. Also works, it should be started at a low dose, and it's better if it's given BID because the half-life is kind of short. Rarely there's a side effect on the liver, which is kind of serious. It can actually cause liver failure in very, very few individuals. But it's important that the person is told and they're cognizant of that risk. It can be recognized if there's a problem with the yellowing of skin. Should periodically get liver enzymes as well. The main side effect is nausea in the beginning. Those for whom it works wonderfully and relatively side effect free. Under the stimulants, we have Ritalin. It was one of the first medications that was tried and accidentally found to be effective. And it has proven its merit. It remains effective and useful. There are long-acting forms of methylphenidate available. And the long-acting forms are better in some ways, especially in adults, because they're less prone to being, they're less likely to be abused. It is the immediate release medication that the addict patients or the addicts are looking to score from because it's released quickly. The slow release ones are not as attractive for abuse. So slow release formulation of the stimulants are available for methylphenidate. The other stimulants are dextroamphetamine, then dextroamphetamine and amphetamine salts combined as a product called Adderall. These are effective as well. Vyvanse lisdexamphetamine is also effective. It's a prodrug. It has to be converted by the liver into a stimulant. So there's less likelihood of this being snorted or abused also. Concerta is another slow release form of methylphenidate. So all the stimulants are more or less alike. May cause a decrease in appetite. Rarely it can cause tics. These are twitches of the face or certain muscle groups. If twitches or tics occur, then the dose of the stimulant should be tapered down or stopped even, and the non-stimulants can be used. Exercise, as I mentioned, is very helpful. Any kind of exercise is good. Removing distractions from the environment is another common sense measure that can be utilized. So these medications are effective. You have all these measures, non-pharmacological, the exercise, you have meditation, TM, yoga. Then you have the medication, the non-stimulant ones that cannot be abused at all. You have guanfacine in that, and it comes under two brand names, 10X and Intinib. Intinib is the one that's 24-hour slow release, and that's the one we use usually. Clonidine is more sedating. It's usually used as an immediate release at night just to help with sleep sometimes. The longer acting form is also available. Then the stimulants, as I mentioned, the Concerta, the long-acting forms of methylphenidate, long-acting forms of the amphetamine salts. They are available and they can be helpful as well. Then the treatment of the ADHD patient may also involve teaching them, techniques on how to manage their impulsivity, because it's not just all about the medications. They can understand the nature of their illness and learn to control it. A lot of intelligent people do manage to control their ADHD symptoms. In fact, the brighter somebody is, the more likely they are to be able to compensate for the deficits. So whatever is working for the person, they should be encouraged to keep using it. So other than that, I think you can find a lot of more information on the internet. There are multiple websites. By the way, myself and a colleague, Professor Paramjit Singh, we wrote a book on ADHD about 6 or 7 years ago. I'll put a link to that too. And there's a lot of other interesting ideas that go towards how someone can improve their concentration and ability to complete tasks. All right, take care. I'll see you in the next video. Thank you. Bye.